How do you define excellence? Is it differentiating yourself from others? Is it providing all-inclusive services? Is it being a leader in innovation and sharing your expertise with the world? Or is it simply providing excellent care time and time again? The answer is yes. St. Barnabas Heart Center at Newark Beth Israel Medical Center is a center of excellence for valve repair. Through the collaborative efforts of our cardiologists and surgeons, we are a leader in minimally invasive and robotic surgeries. We treat our patients more efficiently by utilizing and understanding the valuable information gathered through diagnostic imaging. We were the first to offer many treatments in the New Jersey area and remain unique for our complete continuum of care.
When we initiated the current open heart program at Beth Israel, we made a conscious decision to make this a full-service, 5-star, tertiary, quaternary hospital for heart surgery. We wanted to improve the quality of medical care in the state, not by selecting the patients that would do well, but by selecting all patients and having them all do well.
The benefits of having an integrated valve program is that the patient needs to get the proper operation and needs to have the proper timing for that surgery to have the best outcome. So that the importance of having this whole enterprise integrated is that the surgeon skill is, of course, of paramount importance, but the other issue that's very important is that the field is evolving and it's steadily evolving. So everything that is changing in cardiology in the last several years has to be applied in this program and has to be applied in a proper way to individual patients.
Quality patient care starts with teamwork. Here at Newark Beth Israel, our team of cardiologists and surgeons work to ensure proper diagnosis and together devise the most effective plan for treatment.
I think the teamwork concept is indispensable. No one person in the cardiac arena knows everything about everything relating to cardiology. And when we put our heads together, that's when the outcomes are optimized for the patient.
Well, teamwork is vitally important in a valve program because the types of procedures that are done on patients need to be exhaustively reviewed by the cardiologist and the surgeon together. The importance of this is that you don't want to have the decision-making process in the operating room in the middle of the procedure. You want to give the surgeon as much information as you possibly can prior to them doing corrective surgery, so they know exactly what they're going to face when they get in there and they actually see what the anatomy is and what types of things might work and might not work.
The first step in treatment is a proper diagnosis. Newark Beth Israel boasts all the necessary tools for accurate early detection. State-of-the-art TEE, MRI, and the Philips 64-slice CT scanner. All of these advanced diagnostic modalities are available at St. Barnabas Heart Center at Newark Beth Israel Medical Center.
The current gold standard for imaging valvular abnormalities is echocardiography. Echo as a modality does provide you with pretty sharp pictures relating to valve structure and function. However, cardiac MR also gives you some very, very sharp images of the valves of the heart and also can give you some physiologic information relating to how much of a pressure drop there is across a narrow valve or how much of a leak there is across a leaky or redundant valve.
64-slice CT is important in that we like to know what the conformation of the vessels are or the condition that the vessels are leaving the heart, which are important in some types of aortic procedures. And in addition to that, and an exciting new area is that it's possible that we'll be able to image the coronary arteries, the heart arteries, which may need bypass during a procedure with 64-slice CT, and be able to do all of the valve imaging and valve function studies with echocardiography And it may come to pass that we'll be taking patients to surgery without even doing the more invasive standard procedure that we're doing now, which is cardiac catheterization, which carries its own attendant risks.
Beyond a diagnosis, these pre-op studies can be utilized even further through closer scrutiny. Cardiothoracic surgeons at Newark Beth Israel can specifically customize each procedure by what they see in each and every study.
Once a diagnosis is made and we know what the problem is, then we have to take it to another level and decide what needs to be done about it. And then we have to narrow that down, and we've got to look at perhaps just one little specific portion of the valve, or we have to look at the muscle as well as the valve and so forth, so that as surgeons we can decide exactly what it is that needs to be repaired and what needs to be done.
We prefer to do valve repair whenever we can as opposed to valve replacement, and valve repair is definitely an art. Our surgeons are particularly good at it, and the highest proportion of patients who come out of the operating room with a repair is preferable, and our surgeons to achieve that end. Having a repair is better than a replacement because you just simply don't want to have a foreign body in the heart that might require other drugs like potent blood thinners to be required in the postoperative period. So you'd much rather have a repair, keep the natural valve in the heart as opposed to having a replacement.
Members of the St. Barnabas surgical team are recognized as national leaders in the field of cardiothoracic surgery and are advancing the latest minimally invasive techniques that offer patients faster recovery and fewer complications. Cardiac surgery and valve surgery can now be performed using small scopes through much smaller incisions. The toughest component of valve surgery on the human body actually has nothing to do with what is specifically done to the valve. Trauma, caused by the large incision through the sternum, is what takes the longest to heal and often slows the body in its recovery.
The classic way of doing open heart surgery, valve repair, has been through an incision that extends the entire length of the breastbone. Now we have the ability to do the aortic valve through just a small little incision in the front, and the mitral valve through a small incision underneath the breast that leaves a patient actually with no scar, visible scar whatsoever. In fact, I've had patients go into their doctors and the doctor said, "I thought you had valve surgery," you know, and the guy says, "Yes, I did. Here's my scar." But the scar is probably, in most situations, the least important thing. What really contributes to the morbidity, what delays the healing, is the disruption of the muscles and the bones through the old procedures.
If decreasing the size of the incision helps patients recover more quickly, then valve patients have even better news. The age of robotics has arrived. The cardiothoracic surgeons at the St. Barnabas Heart Center at Newark Beth Israel Medical Center are among an elite group of practitioners approved to use the Da Vinci surgical system to perform robotic heart surgery. Robotics means smaller incisions, more accurate movements, increased visualization.
Well, Dr. Saunders is at the cutting edge of robotic surgery. He actually brought the device to the system several years ago, and I've seen some of the procedures that he and his team perform, and they're pretty spectacular in that they're able to see tiny little structures in the heart much better than if the chest were open, and these procedures are much less traumatic for the patient as opposed to opening the chest in any way, shape, or form.
Robotics in valve surgery takes it to a whole new dimension, a whole new level of approach. Basically, it's a new instrument to use. You still need the surgeon's skill, you still need the ability to repair the valve, but these are different instruments that can be put in through tiny little incisions, about as big around as your finger. There is almost no postoperative pain or discomfort afterwards. The magnification, you can get up to 10 times magnification, and so you can actually do more delicate work than you might with standard instruments. Along with that magnification, there's no tremor, there's no movement. The computer takes all of that out.
The center's reputation for excellence has also made them an educational resource for surgeons throughout the Northeast. Newark Beth Israel is a national training center for intuitive surgical instruments, the makers of this space-age Da Vinci robotic system.
The advantages of being a national training center is that many surgeons come through the hospital to train with Dr. Saunders and his group and learn the newest techniques. In addition to that, we'll be receiving the newest technology from the company for trial purposes and development purposes, and we'll be seeing the newest things that they have to offer. Because we're a national training center, we'll be at the cutting edge of new techniques for robotic surgery.
Teamwork, advanced diagnostic imaging, state-of-the-art technology, sharing our expertise with the world, brighter patient outcomes. We are the Valve Center of Excellence.
I think one of the things that contributes to an excellent valve center is the fact that you can handle the full spectrum of the patient's needs and tailor the operation specifically to the patient's needs. In the old days, it used to be just replacing a valve, taking one out and putting one in. Now it's become much more sophisticated with repairs of the valves or portions of the valves and so forth.
Continuing to advance cardiovascular care. St. Barnabas Heart Center at Newark Beth Israel Medical Center.